How many total groups exist in the RUG 3 Plus classification model? A. 34, B. 44, C. 7, D. 105. The correct answer is B. 44. The RUG 3 Plus classification model is specifically designed as a 44-group model. It uses 69 assessment items from the RAI LTCF tool to categorize individuals into one of these 44 distinct clusters to accurately estimate the level of care resources they require. While the model starts by sorting residents into 7 overarching clinical categories, such as special rehabilitation, extensive services, and clinically complex, these categories are further subdivided based on factors like activities of daily living, ADL, scores and therapy minutes to create the total of 44 specific classifications. What ADL score range qualifies a resident for the highest tier of special rehab, ultra high? A. 4 to 8, B. 9 to 15, C. 16 to 18, D. 19 to 21. The correct answer is C. 16 to 18. According to the RUG 3 Plus classification model, the ultra-high subcategory, which requires 720 therapy minutes, within the special rehabilitation group is further divided into specific groups based on a resident's ADL index score. The highest tier within this subcategory is Rank 1, designated as Group RUC, which requires an ADL index score of 16 to 18. For context on the other score ranges within the ultra-high category, 9 to 15 qualifies a resident for the second tier, Rank 2, RUB. 4 to 8 qualifies a resident for the third tier, Rank 3, RUA. What is required to qualify for the extensive services group? A. Having a feeding tube alone. B. Daily 4 therapy only. C. Any physician visit during stay. D. Tracheostomy or ventilator with ADL 7+. The correct answer is D. Tracheostomy or ventilator with ADL 7+. To qualify for the extensive services group in the RUG 3 Plus classification model, a resident must have an activities of daily living, ADL, index score of 7 or higher, and be receiving specific high-level care treatments. These qualifying treatments include tracheostomy care, the use of a ventilator or respirator, or being placed under infection control, such as isolation or quarantine. What does a higher resource utilization group/case mix index, RUG/CMI, value indicate? A. The resident requires less care. B. The resident uses fewer resources. C. The resident needs more care and resources. D. The resident's social engagement level. The correct answer is C. The resident needs more care and resources. In the RUG 3 Plus classification model, each resource utilization group is assigned a specific case mix index, CMI, value, or weight, which reflects the relative level of resource use required for that resident. A higher CMI indicates that the resident has more intensive care needs, which corresponds to a requirement for more resources and ultimately results in higher funding. Which RUG 3 Plus group typically includes residents with progressive cognitive impairment? A. Special care. B. Behavior problems. C. Impaired cognition. D. Clinically complex. The correct answer is C. Impaired cognition. In the RUG 3 Plus classification model, impaired cognition is one of the 7 primary clinical groups. Residents qualify for this specific classification if they exhibit significant cognitive deficits, which is formally identified by having a cognitive performance scale, CPS, score of 3 or greater, combined with an activities of daily living, ADL, index score of 10 or less. For context on the other RUG 3 Plus groups provided in the options, special care encompasses residents with serious medical conditions such as septicemia, stage 3 or 4 pressure ulcers, or cerebral palsy. Behavior problems categorizes residents who display challenging symptoms like wandering, physical or verbal abuse, hallucinations, or delusions. Clinically complex includes residents requiring skilled nursing management and interventions for conditions such as pneumonia, internal bleeding, dialysis, or chemotherapy. Which statement best describes the relationship between AOL score and RUG grouping? A. AOL score doesn't influence group assignment. B. The lower the score, the more likely rehab will be triggered. C. Higher scores indicate more intensive care needs. D. Lower scores indicate lower resource use. The correct answer is C. Higher scores indicate more intensive care needs. Assuming AOL is a typographical error for ADL or activities of daily living. In the RUG 3 Plus classification model, the ADL index score is calculated based on a resident's level of dependence in 4 key functional tasks: bed mobility, toilet use, transfer toilet, and eating. Higher scores on these ADL assessments consistently reflect greater physical impairment, meaning the resident relies more heavily on staff assistance to complete daily tasks. This calculated ADL score is a driving factor used across almost all of the overarching clinical categories to determine a resident's specific subgroup and rank. For instance, within the ultra-high tier of the special rehabilitation group, a resident with a high ADL score of 16 to 18 is placed in the highest priority rank, rank 1, RUC, while a resident with a lower score of 4 to 8 drops down to a lower tier, rank 3, RUA. Because higher RUG groupings and their corresponding case mix index, CMI, values dictate that a resident requires more care and funding, higher ADL scores directly translate to more intensive care and resource needs. The RUG 3 Plus system uses only diagnosis codes to assign residents to groups. True, false, false. The RUG 3 Plus system does not use only diagnosis codes to assign residents to groups. Instead, it utilizes 69 different assessment items from the Inter-RAI LTCF tool. Residents are assigned to a RUG 3 Plus group based on 3 key dimensions: 7 resident clinical groups, example special rehabilitation, extensive services, special care, clinically complex, behavior problems, impaired cognition, and reduced physical functions. 2 functional measures of activities of daily living, ADLS. 3 extensive services qualifications and specific treatments, such as the total number of therapy minutes received. A lower ADL index indicates higher care needs in the RUG system. True, false, false. In the RUG 3 Plus classification system, it is actually a higher ADL index score that indicates greater physical impairment and therefore higher care needs and resource requirements. A lower ADL score indicates that the resident is more independent and requires less staff assistance. 4. Example, within the ultra-high tier of the special rehabilitation group, a high ADL score of 16 to 18 places a resident in the highest priority rank, rank 1, RUC, whereas a lower ADL score of 4 to 8 places them in a lower priority rank, rank 3, RUA. All RUG 3 Plus groups require the same ADL score for classification. True, false, false. In the RUG 3 Plus classification system, different groups require different ADL scores. A resident's specific activities of daily living, ADL, index score is a primary dimension used to further sort them into one of the 44 distinct subgroups. For example, within the special rehabilitation ultra-high subcategory, placing in the RUC group requires an ADL score of 16 to 18, while placing in the RUA group requires a lower ADL score of 4 to 8. What is the main purpose of the RUG 3 Plus grouping system? A. To track medication side effects. B. To improve medication adherence. C. To estimate care needs and resource use. D. To group medication usage by class. The correct answer is C. To estimate care needs and resource use. The RUG 3 Plus classification system categorizes individuals into clinically similar groups based on their acuity and care needs. Its primary purpose is to estimate the level of care resources required for each group in long-term care facilities. This grouping methodology ultimately supports evidence-based planning and case mix adjusted resource allocation at both the facility and system levels. Which indicator reflects the percentage of residents on antipsychotics without a diagnosis of psychosis? A. Delox B. Dragoi C. Payox D. CNT04. The correct answer is B. DRG01. According to the Inter-RAI-LTCF training materials, DRG01 is the prevalence quality indicator that measures the percentage of residents on antipsychotics without a diagnosis of psychosis. In the calculation of this indicator, the numerator specifically counts residents who have received an antipsychotic medication in the last 7 days. To ensure the indicator only flags inappropriate or off-label use, the system utilizes assessment level logic to exclude individuals for whom these medications might be expected. Specifically, residents are excluded from this calculation if they have a diagnosis of schizophrenia or Huntington's disease, if they experience delusions or hallucinations, or if they are receiving palliative care or have an end-stage disease. For context on the other options provided, Black Circle Deluxe measures the percentage of residents with symptoms of delirium. Payox measures the percentage of residents with moderate to severe pain. Black Circle CNT04 measures the percentage of residents with a urinary tract infection. Which domain includes indicators for ADL improvement or decline? A. Mood B. Continence C. ADLS D. Communication. The correct answer is C. ADLS, activities of daily living. According to the Inter-RAI-LTCF training materials, the activities of daily living domain categorizes several incidence quality indicators, CHIs, designed to track both positive and negative changes in a resident's physical functioning over time. Specifically, this domain includes improvement indicators, measures the percentage of residents whose functional status improved in early loss ADLS, ADL06, mid-loss ADLS, ADL05, or late loss ADLS, ADL1A. Decline indicators, measures the percentage of residents whose functional status worsened in early loss ADLS, ADL6A, mid-loss ADLS, ADL5A, late loss ADLS, ADL01, or whose overall ADL self-performance declined, ADLD7. All residents are included in every CHI calculation. True, false, false. According to the Inter-RAI-LTCF training materials, not all residents are included in every quality indicator, CHI, calculation. Each CHI utilizes specific assessment level logic to determine who qualifies for inclusion. During this process, the system applies exclusion criteria to remove residents for whom the specific outcome is expected or inappropriate to measure. Only the remaining assessed residents who meet the eligibility criteria form the denominator for that specific CHI. Risk adjustment removes all biases from CHI comparisons. True, false, false. While population risk adjustment is a critical statistical step used to account for case mix differences across facilities, it does not remove all biases. Instead, its specific purpose is to adjust for factors beyond a facility's control, such as whether a facility inherently cares for a higher or lower risk resident population. By applying these formal statistical adjustments, the system ensures that facilities with higher risk populations are not unfairly penalized when their quality indicator, CHI, scores are calculated. This process levels the playing field to allow for more meaningful facility comparisons and continuous quality improvement, but it is not intended to eliminate every conceivable bias in the data. Which of the following would be excluded from incidence CHIs? A. Residents assessed in previous fiscal year. B. Residents with missing values. C. Residents assessed in past 40 days. D. Residents in private pay beds. The correct answer is C. Residents assessed in past 40 days. Under the General Exclusions Incidence Guidelines, calculating an incidence indicator requires comparing the current assessment to an assessment from the previous quarter. To be included, that previous assessment must be at least 45 days and no more than 165 days old. Because an assessment completed within the past 40 days falls short of the minimum 45-day requirement, the resident would be excluded from the incidence CHI calculations. Which CHI would most likely be influenced by persistent incontinence and limited mobility? A. Ugtoy B. CNT04 C. Pru 06 D. Cat 02. The correct answer is C. Pru 06, Percentage of residents whose stage 2 to 4 pressure ulcer worsened. The combination of limited mobility and persistent incontinence significantly increases a resident's risk for skin breakdown and pressure ulcers. This is directly supported by the Inter-RAI Pressure Ulcer Risk Scale, PURS, which calculates a resident's risk for developing a pressure ulcer based on specific factors that include their walking and bed mobility performance, as well as their bowel continence. Furthermore, the materials explicitly link these factors together, noting that severe mobility impairments are high-risk conditions for pressure ulcers, and that a decline in activities of daily living, ADL, self-sufficiency can lead to a cascade of complications including both incontinence and pressure ulcers. Therefore, PRU-06, which tracks the worsening of stage 2 to 4 pressure ulcers, is the quality indicator most likely to be negatively impacted by these specific issues. For context on the other options, WGT01 tracks unexplained weight loss. Black Circle CNT04 tracks the percentage of residents with a urinary tract infection. Black Circle CAT02 tracks the percentage of residents with indwelling catheters. Which indicator tracks residents with worsening cognitive status? A mod for A BCOG01 CCOM01 DBEHD4. The correct answer is BCOG01. According to the Inter-RAI LTCF decline incidence indicators, COG01 specifically tracks the percentage of residents whose cognitive ability worsened. For context on the other options provided, Black Circle Mod 4A tracks the percentage of residents whose mood from symptoms of depression worsened. Black Circle COM01 tracks the percentage of residents whose ability to communicate worsened. Black Circle BEHD4 tracks the percentage of residents whose behavioral symptoms worsened. Which CHI measures newly occurring stage 2 to 4 pressure ulcers? A PRU-09, B PRU-06. D PRU-01. The correct answer is A PRU-09. According to the Inter-RAI LTCF training materials, PRU-09 is the incidence quality indicator that measures the percentage of residents with a newly occurring stage 2 to 4 pressure ulcer. To calculate this indicator, the numerator specifically identifies residents who did not have a stage 2 or higher pressure ulcer on their previous assessment, coded as 1 or less, but currently present with a stage 2 or higher. The denominator is made up of all assessed residents who meet the inclusion criteria and are not excluded. For context on the other relevant options provided, PRU-06 measures the percentage of residents whose existing stage 2 to 4 pressure ulcer worsened. PRU-05, likely what PRU-0 is meant to be, is a prevalence indicator that measures the overall percentage of residents who had a stage 2 to 4 pressure ulcer at the time of assessment. Which of the following factors contributes to determining a resident's RUG 3+ group? A number of roommates. B type of flooring in room. C clinical condition, ADL score, therapy minutes. D resident length of stay. Only the correct answer is C clinical condition, ADL score, therapy minutes. A resident is assigned to a RUG 3+ group based on key dimensions that include 7 resident clinical groups, such as special rehabilitation, extensive services, special care, clinically complex, behavior problems, impaired cognition, and reduced physical functions, their functional measures of activities of daily living, ADLS, and extensive services qualifications. Specifically, these factors contribute to the grouping in the following ways. Clinical condition, residents are categorized based on the presence of specific conditions or behaviors, such as septicemia, pneumonia, hallucinations, or whether they require extensive services like tracheostomy care or ventilators. Therapy minutes, within the special rehabilitation group, classification relies directly on the total number of therapy minutes a resident receives. Example: ultra high requires 720 minutes, very high requires 500 minutes, and the number of days the therapy is administered. Black Circle ADL score, the calculated ADL index score is used across almost all of the clinical groups to further determine the specific subgroup and rank the resident's resource intensity. Which of the following best represents the order of clinical priority used in RUG 8+? A. Extensive services, special care, Special rehab B. Special care, special rehab, extensive services C. Special rehab, extensive services, special care D. Clinically complex, special care, extensive services. The correct answer is C. Special rehab, extensive services, special care. According to the Inter-RAI-LTCF training materials, when using the hierarchical method to assign a resident to a RUG 3+ group, the system reviews all qualifying groups in a specific clinical priority order. The full top-down hierarchical order for the clinical groups is 1. Special rehabilitation 2. Extensive services 3. Special care 4. Clinically complex 5. Behavior problems 6. Impaired cognition 7. Reduced physical function.